In today's video, we'll talk about how to break bad news to a patient and the family. Breaking bad news is a fundamental skill that you have to acquire, especially as a doctor, because it's something that you'll find yourself doing quite often in the line of duty. And that's why today I thought about, going through how to do it, how to set yourself up for that discussion, which a lot of times can have an effect on the people that you're talking to and also on yourself as an individual. My name is Anna at Migrant Dr. Mom, and I'm so glad you could find time to join me today. So I'm covering this topic because I get a lot of queries about this, and it's mainly because in Australia, it's actually taught in school. How to break news is a topic that's actively taught to medical students, but I think it's not something that I knew or I can confidently say I was taught how to, and I must say it's an area that is commonly put across exams, both undergraduate exams, postgraduate exams, and also fellowship exams as a general practitioner. So breaking bad news is important because, like I said earlier, it will have an effect on you as a doctor, but it will also have an effect. How you do it will have a lasting effect on those that you're speaking to about. And when I talk about bad news, it's a whole spectrum. Talking to somebody who has, unfortunately had a miscarriage, talking to somebody who's having a new, significant diagnosis like cancer, or also just generally talking to somebody that has lost their loved one and you want to break the news, whether in person or over the phone. So generally, it is, I find it quite, I must say, a full-on experience, like especially when I have to do it. A lot of times there are a lot of emotions involved, but if you have a structure, like I always say, then you would be able to do it. So how do you prepare yourself before you share the news? Let's say you've had, a result come through saying that your patient has been diagnosed to have cancer of the pancreas. How do you prepare yourself to break this news to the patient? And like I always say, you have to prepare. Preparation is essentially key in everything that you do. You've got to prepare yourself, take a moment and collect all the information that you need. Like, for example, if it's a CT scan that has come through, check, go through the information that you've got on the patient, go through, if it's your regular patient, you probably know whether they have a support system or not and stuff like that. And I must say that's a result that you have got to tag as an urgent result and try and get the patient to come in urgent enough. And if the other thing that you need to try and prepare is, the environment. So choose the right setting for the patient, ensure that it's a private place, it's a quiet place. And I always say have tissues by the side because a lot of times there are tears involved. And so you need to be able to, set the environment well enough that you're on one, either onto one side and you set up, a lot of times it will be as per your examination room anyway, where the patient is sitting. If it's in a hospital setup, you will try and get them either into a single room or into a different room where they will all sit down and then you can break the news to them. And ensure, obviously, consent is quite key, which is something that in Australia you've got to do. Get consent and ask them if they're willing to, get the results and stuff like that. There are many protocols that you can use for breaking bad news. The commonest one is spike, and then the other one is breaks. So today I'll be talking to you, going through breaks in detail, and then I would put at the end of it, I'll put a description for spike, which is exactly similar. The very things that you do during this process is exactly the same. It's just that you need to find one that works easy for you. And for me, I find breaks to be the easiest to remember, but you can still use the spikes protocol course. So in breaks, which is BREAKS, is establish the background, find out, establish rapport, and establish the context, introduce yourself. And this would be especially in a situation where you're sort of newer to the patient, like let's say an after hours death or event has happened, or patient has had a significant fall, and you've called the family and you want to talk to them. I will say that you have to introduce yourself and say, this, my name is Anna. I am the, registrar, or I am the SMO, or I'm the general practitioner looking after this patient. But if it's in general practice, of course, the patients will probably know you, but then you may have to still say, especially to their family members, I am so and so, and this is my patient, and blah, 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 and something like that. So confirm. The next thing under, background is you need to confirm the understanding of their condition. Ask the patient specifically, what do you think is going on? And if, for example, they were coming in for a result that had been ordered by your colleague, just ask, do you know why you got this test done? Do you know what, sort of have an idea what's going on? And then they'll tell you, oh, I was getting this test done because I've lost significant amount of weight. I've been having changes in bowel habits, or I'm getting a lot of night sweats and I'm not sure what's going on. So sort of understand their context and their understanding of why the test was done. And that will set a basis for you to sort of continue to gauge their understanding or the extent up to which that they will want you to give that information. The next thing is which is R, is establish the rationale, explain the reason for the bad news. And this is the time where you have to clearly state the diagnosis or the test results. And I always say avoid using jargon. So sometimes there is, you've gotten a result, let's say a scan that's suspicious for cancer of the pancreas. So I will probably start off and say, I'm sorry, I do not have bad news for you today. The test that we did, because we were worried about something wrong going on, or we were worried about that swelling that was there. We took a biopsy. I'm afraid to report that the results are not good. And then I would normally just take a bit of a pause and say the results are showing that you have cancer of the pancreas. And then, because it's important to state it as is, not to say, and sugarcoat it and stuff like that. It's important to clearly state that this is what it is. And, and there, give them a bit of time for things to sink in. And then obviously, as you wait for things to sink in, remember to provide emotional support. Obviously, you need to show empathy. You need to show compassion. Remember, this is the time that the patient's feeling will come through. Some will be completely quiet. Some will break out crying. Some will ask you questions. They will ask you, like, what's going to happen to my children? What's going to happen to, will I get to Christmas and stuff like that? But at that point in time, remember, your biggest role there is to provide emotional support. If they're crying, provide a tissue. Your non-verbals will come in quite handy. This is the time that you will sort of try and you can pat them appropriately, of course. You can allow them to cry, and then and stuff like that. So it is at that point in time where your empathy needs to really come through, and you need to provide the understanding and give them time. Don't rush the process through. Give them time to go through the emotions. If they go completely quiet, there are people that will oddly go quiet and they will almost scare you. But I think at that point in time, you just allow them to go through. And I think the other important thing that I forgot to mention is such discussions are best done in person, and such discussions are best done with a support person. So as you make the appointment for the patient, make sure that they have, they have a bit of support in that, someone is there with them, their loved one is there with them. The next action, which is the A, is the action. At that point in time, you may want to discuss treatment options and the next step, and you may not actually have all the treatment options. And I always say, like, if you're in general practice, try and provide some some hope. It's not like you're providing, like, you're telling them they're going to be completely cured, because even yourself, you do not know that they're going to be completely cured. But that's the time you tell them, look, I am going to refer you to an oncologist, and the oncologist will do a few more tests, and then they will guide you towards what's going to happen next. I'm afraid I do not have all the information that you may need, but I want to assure you they are specialists in this area that will look after you. There are people that will provide you the much needed information. And then at that point in time as well, involve them in the decision making. Are you happy with this? Are you happy for me to go ahead and send the referral? Are you happy for me to involve, if they've not come in with their loved ones, are you happy for me to call your loved ones for you? Are you happy for me to call your son or your daughter or something like that? That's the time that you set up actions on how you are going to do things. So explain that and allow the patient to make decisions, because some patients will outrightly tell you, I don't want any treatment. Or patients would outrightly tell you, I don't want you to refer me anywhere. I'm happy to be at home and stuff like that. So it's at that point in time that you need to establish that. Okay. Next thing is provide additional knowledge. So K is for knowledge. Provide additional knowledge and resources. Offer educational materials. Offer, the referral systems. Explain to them in detail. And then that's the time that you try and address their questions and concerns. I have to put a disclaimer, because you have to be as honest as possible. If you do not have the answers, because some patients will ask you, so what does this mean for me? What's my prognosis? What's going to happen? You may not have all those answers because you're not the specialist. But at that point in time, be honest enough to tell them, I'm afraid I do not have all the answers, but I'm going to send you to the right people who may have the answers after they look at the bigger picture and they've had a discussion in the multidisciplinary team, and they will come up, with a treatment plan for you and tell you the treatment outcomes for every treatment plan they will have for you. So very important to do that. And then if there are, any specific centers you're sending them, or like, let's say, the, dementia association, or, let's say, breast cancer clinic, or, that's the time to provide the much needed information. And then in the S, remember to always provide support. Okay. I think at the end of the day, the best thing you can provide to a patient that is having bad news is to give them hope and support. Support them in that, I mean, support them and tell them, look, this is going to be a tortuous journey for you. This is going to, you're going to have ups and downs, but I want to assure you that I will be here as your general practitioner. And if I'm not here, one of my colleagues will look after you. And then tell them, look, I will be more happy if you came back in. I would like to see you in a week or two. And then I will provide, try and provide like mental support if they need psychology referrals and stuff like that. If they need to come in, assure them, of your availability depending on the days that you work, and tell them I'm available on these days. Feel free to make an appointment and come in and have a chat. Okay. And then the other thing in terms of support, ensure the patient knows who to contact. Like, for example, if they got too unwell, like let's say a patient has been diagnosed with cancer of the bowel, tell them if you develop these following symptoms, like let's say you develop signs of obstruction, like you're vomiting, you can't keep anything down, you need to present to emergency department, because that would mean that you're having bowel obstruction. Or if you develop, severe bleeding, melena, which is like dark stools and stuff like that, you're feeling dizzy and all, you need to present to hospital. So it's important to know, to tell patients and safety net them in a way that if things go wrong, they know where to go. And the referrals that you're sending, tell them, if I'm sending this through to this hospital, if you have not heard from them, let's say in a week, let me know so that we can try and make sure, this has been received and stuff like that. And obviously make a follow-up appointment just to make sure that they are coping okay. and make a follow-up appointment to know that, and also just make sure that, you know, the referrals have been received, they have appointment dates, and generally to support them psychologically if they need anything additional. So it is quite important to have that sort of, you know, schedule. And even as you prepare for this difficult conversation with your patients, you can even write it down, you know, have your little notes by your side to say, I will tackle this, I will tackle this, I will tackle this. And I will provide, you know, if they're elderly, you know, that's the time you need to start thinking about, you know, when they start treatment, they're going to functionally decline. And that's the time you need to start thinking about, you know, supports in the community. You need to start thinking about, do they need to be referred for, you know, ACAT and something, things like that, which will be things that will support them in the community. If they need additional services in the community, that's the time to start thinking about such things. So it's very important when you're breaking this news, be it to a patient that has cancer, be it to a patient that has terminal COPD, or end-stage COPD, end-stage heart failure, and stuff like that. Very important to have these discussions because they will form the foundations on how the patient is going to proceed forward. And remember to always provide them with a bit of hope and support. I think the biggest thing I've noticed with patients is they just want somebody to listen to them. They want to know that somebody understands where they are at and that they can come back to you if they are unsure of anything. Some of the quick additional tips I must say: ensure at all times you're honest. If you do not have the answers, tell them, I do not have the answers, but there will be somebody that may have the answers. And sometimes, I'll be honest with you guys, I coach my patients and tell them, when you go to see the specialist, please write down the questions you're going to ask the specialist. Ask them 1, ask them 2, ask them 3, ask them 4. Because a lot of times patients go to see the specialist and then they come back and they start asking me questions. I'm like, you know, you are the specialist. That's the right person to ask these questions. But again, so nowadays I've learned, I tell them, when you see the specialist, ask them 1, 2, 3, and 4. And if you have anything additional to ask, write it down, because as soon as you're in front of the patient, everything disappears, you forget. But if you've got it written down, you'll ensure all your issues are addressed and you are supported. Avoid jargon at all means. Use as simple language as possible. Give information in small chunks. Allow them to absorb and digest the information you've given them, and offer them time to ask questions. And if you can, respond to the best of your ability. Above everything else, I always say, if it's not documented, it's not done. So you have to document your discussions, you have to document your plan going forward, and you have to document the patient's wishes. So as you can see, it's a mouthful discussion, but at the end of the day, it can be done by yourself. And just remember, if you don't do it well, it will have a lasting impact on the patient and the family in front of you. I hope this is helpful. And if it is, share it and like and subscribe for more content as this. And if there's anything you'd like to add, by all means, comment. Thank you so much for watching. God bless.